Hi everyone, I am Shivashankari working as a nursing tutor in Sri Shanmuga College of Nursing for Women. Let's discuss about administration of intramuscular injection. Introduction. Intramuscular injection may be preferred because muscle have larger and more numerous blood vessels than subcutaneous tissue, leading to faster absorption than subcutaneous or intradermal injection. Next definition. An intramuscular injection is the administration of medication or a vaccine directly and deep into a specific muscle tissue using a needle and syringe. Next one, purpose. It is simple and accessible to obtain quick effect of medication. That means while we administer IM, it will take fast action for patient who suffer illness. Muscle tissue can often hold a larger volume of fluid without discomfort. We have take IM and all we have give more than 5 ml, not more less than 5 ml, not more than 5 ml. We have to administer IM and all. Next one, certain drugs that are not recommended for other routes of administration. That means IM and all we have give only IM intramuscular only, not give an IV or oral subcutaneous, any other else we don't give. Next one, slightly irritant drug can be given. For example, slightly irritant drug and all paracetamol we have given IM only. Next, requirements. What are the articles needed for IM injection? A tray contains syringe and needle, alcohol swab, vial, ampules of medication, disposable glove, kidney tray, ampule cutter, white PPC. These are all the things we have to follow for while administering the IM medication and all. Next one, sites of intramuscular injection. What are all the sites we have listed? We have seen. The first one is deltoid muscle. It is locate the acromion process. We have to place a finger on the acromion process and measure 3 finger breadth down, and we have to administer a injection in that area. Next one, vastus lateralis. It was mostly used for infant in a supine position only. We have to divide the thigh into a third, 3 parts like in that middle third we have to give the injection. That is the correct route for administer vastus lateralis site. Next one, intragluteal. Place the palm of your hand on greater trochanteric, the index finger on an anterior superior iliac spine and middle finger pointing toward the iliac crest. After that we have to administer the injection in the ventrogluteal muscle. This is the site you have seen here. Next, dorsogluteal. In this never we didn't give for infant and small children. We never use dorsogluteal and all because there is a sciatic nerve present, so we can't able to give for infant and children. It is dangerous for infant and children. Landmark posterior superior iliac spine and great and trochanteric. Find the center and give the injection. This is the correct route for dorsogluteal muscle site. These are all the things for sites of infection. Next we move on rights of medication. What are all the rights we listed? Right patient, right time, right dose, right route, right drug, right frequency, right documentation and right medication. Right patient means we have to check a medication chart or drug chart, and once we cross check the patient ID band also. After that we have to administer the medication. Right time means we have to administer medicine as the timing itself we have to administer. That is the right timing. For example, if patient administer the IM for 6 a.m. means we have to administer 6 a.m. only, not 7 a.m., 8 a.m. and all. That is the wrong time for administer. Next, right dose. Right dose means what are all the dose was doctor prescribed, we have to give that right dose. Next one, right route. What are all the route also doctor mentioned, that only we have to give in that. Next, frequency documentation. These are all the things. Documentation is major and most important thing. This is a legal document, so we have to document everything and all. Next, drugs only given by IM. What are all the drugs we have to given in IM? In IM and all, we have give vaccine, hormonal preparation, antipsychotic drugs. These are all the things we will give. Vaccines and all, TT, hepatitis B, rabies vaccine, influenza vaccine. These are all the things we will administer. Hormonal preparation and all, testosterone, depot, metroxy, progesterone acetate. These are all the things we administer in IM and all. Next, antibiotics. Antibiotics and all, penicillin, streptomycin. These are all the injections we administer only IM. Next, vitamin injections. Vitamin injections and all, vitamin B12, vitamin D. These are all the things we administer in IM. Analgesic and all, diclofenac, ketorol, tramadol. These are all the things we administer in IM. Next one, emergency drugs. Adrenaline, anti-snake venom, human immunoglobulin, iron dextran. These are all the things we administer these are the list outed things we administer only IM. Next, procedure. In the procedure, explain the procedure to the patient. Before administering the IM and all, we have explained the procedure. First, after that, we go to do a procedure for the patient. Next, select the medication. What are the medication was doctor prescribed? We have to administer that. After that, hand washing. Hand washing is the major and most important thing while administering the medication or doing any procedure. Next one, prepare the medicine. Keep the syringe with the medication in the sterile tray and cover it to prevent infection or cross infection and all. So that's why we have placed the sterile tray and cover the injection and all. Next, make sure that the medication taken right and correct dosage. Next one, carry medication to the patient in a sterile tray. Next, identify the right patient, prepare the site for infection, inject the medication by correct technique and all we have to follow. Needle is insert at a 90-degree angle. If while administering the IM and all, we have to administer 90-degree angle. We have to administer. If blood not written means we have to administer the medication slowly. And after that, remove the needle and all, gently massage the site. After that, replace the articles. After the procedure, we have to wash the hands. These are all the most things we have been followed. After these things, we have to record the documentation and record the administration in a documentation. It is most and major important thing in our procedure. Next one, what are all the errors what are all the error made by us, that and all? Prescribing error, dispensing error, documentation error, administration error, transcription error, intending error. Most documentation error was occurred. We have to prevent that and all. Proper documentation is most important. Administration also important. Intending error also important. While we intend the medication means double check the medicine. After that we have to indent the medication and all. These are all the medication errors. Next one, nurse's responsibility. What are all the responsibility we have to follow means check the doctor's order. Second one, to know about the purpose of injection. What is the purpose, action and all we have to know. Third one is patient details should maintain properly. Fourth one, allergic reaction should monitor after administration. After administering the medication, if patient had any allergy means we have to identify and inform to the doctor and all. Next, fifth one, patient previous history should be known. If patient had any allergy means we have to mention in the patient case sheet and all in red pen itself to identify any allergy reaction is there. If suppose patient have any allergy reaction of certain drugs means, first of all we inform to consultant and ward in charges and all. After that we inform to clinical pharmacist. It is the purpose of they will take adverse drug reaction form, they will take ADR form. So that's why we have to inform to the clinical pharmacist. They will take care of the patient for further further complication and all, they will take care and monitor and report it. So that's why we have to inform clinical pharmacist and all. Next one, complication. What are all the complication will occur means access or collection of pus, tissue necrosis, granuloma, muscle fibrosis, hematoma, chance of sciatic nerve injury. While administering the IM, we will not administering in a proper technique or proper manner or site means patient will suffer a patient will affect sciatic nerve injury. So that's why we have to administer a IM and all safe and secure. Next one, prevention of IM complication. What are all the things we have to prevent means select the correct injection site. That means intragluteal, deltoid, vastus lateralis based on age, muscle mass and drug volume. Next one, use the correct needle size and length. Next, follow strict aseptic technique to prevent infection. This is the most important. Check the drug dose through time and patient before administration. Next one, avoid injecting into inflamed edematous or scarred areas. Next one, aspirate when indicated to avoid intravascular injections. Next one, inject medication slowly to reduce pain and tissue damage. Next, limit volume per site, usually 1 to 3 ml depending on site and patient. Use Z-drag technique for irritating medications. Example, iron preparations and all. Don't massage the site after administering certain drugs. Example, vaccine, heparin. While we administer these things, we don't massage the site. Observe the patient for pain, bleeding, allergic reactions or nerve injury. Next one, rotate injection site for repeated injections. Next one, summary. To know about the rights of drug administration, proper needle handling procedures and proper documentation of medication administration. Poor injection technique can lead to adverse outcome for the patient, rotation of sites in therefore recommended to avoid irritation, scarring of tissue and pain. Thank you.